Oregon. Thank you so much for joining. This evening, the name of our webinar is Turn, 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 Options for Turning and Birthing Breech Babies. And as a prenatal family chiropractor, this is something that I feel very passionate about talking about, and I feel very knowledgeable. And I would love for this to be a good resource for families who are experiencing a breech presentation with their pregnancy, and to help empower you and inform you, give you the knowledge and education foundation that you need to make sure that your choices that you're making for your birth of your baby and leading up to your birth fit your health paradigm, that you're not just following the status quo, but you're feeling empowered and informed and making the best choice for you and your baby. So I'm going to do an overview of what does breech mean, what are the different types of breech, what are options for prevention, as well as treatment, and then into birthing. And I'm also going to go a little bit into the history of breech birth and how that's changed and when it's changed, and really have everything evidence-based. So if you want any of the studies that I mention, feel free to send a message, and let me make sure my chat is open here. So if you guys have any questions while we're going, feel free to type them in the chat and it'll pop up on here, and I'll be able to address it live. If you're watching this recorded, go ahead and just send a message to our office, or you can email me at saralutz@purelightfamily.com. Okay, so let's go ahead and jump in. So when I say breech presentation, I'm just going to be really start from the basics. So presentation refers to how baby is positioned in the uterus, in utero, and they, up until about 7-8 months, they can move around. Sometimes they'll be head down, sometimes they'll be head up, but vertex position, which is head down, should be where baby goes by about 7-8 months. Typically think between 28 and 32, 34 weeks. In our practice, we typically like to see baby head down by about that time. But so why are some babies breech? And it's a controversial conversation in some regard, because there are some providers who really still agree that breech is a variant of normal, and I definitely fall into that category where sometimes it is a normal presentation. There's different reasons why it can happen, but only about 4% of babies that are full term between 38 weeks to 42 weeks, only 4% are usually in a breech presentation. And if it is more of a structural issue, there's limitations on baby being able to move head down. This can be due to structural changes in terms of the mother's pelvis, maybe something like rickets. If you've heard of rickets, is vitamin D deficiency when they're younger. The bones and pelvis can form differently, which can affect basically how the uterus is sitting and how baby is positioned in the womb. That's very rare. Poor bone and joint development is definitely a thing, but again, it's very rare. There could be old injuries, like old fractures or injuries to the pelvis, that can lead to structural abnormalities. But I've seen athletes in our practice, mamas who are professional athletes who've had pretty severe injuries to their spine and pelvis, able to birth naturally and have their baby head down. But it is a situation. There can be uterine abnormalities. So I don't like the word abnormalities, actually, uterine uniqueness. Every woman is perfect in their own way, and there's some situations where that a woman's uterus might be tilted in a certain way, might be shaped in a certain way, might be just structurally attached in her body in a certain way that is restricting baby's movement to go head down. Placenta previa is when the placenta, which is supporting the baby's growth, is an organ that your body develops. It's when that is either too close to the cervix, the birth canal, or it's completely blocking, and that can affect baby's ability to turn. Multiple pregnancy, so like twins or triplets, often one of them will be breech. Excessive amniotic fluid, excessive pressure can affect baby's ability to turn head down. And then also fetal issues. So if the baby's having certain issues with their development, it can affect their ability to turn head down. So those are all most of the examples of why this happens. What are the causes of breech presentation? But again, everything I just listed is 4%. of breech presentations. That's a very, very small number. Of full-term babies, it's 4%. So it sounds like a lot, but of information, like a lot of things that can happen, but they're all very, very rare. So let's now go into a little bit more foundation. What are the different types of frank breech? So we talked about what it is, what can cause it, and now what are the different types? So there's three main types of breech, and then there's transverse presentation. So transverse presentation, we'll do that first, is basically when the baby's lying sideways in utero. So instead of being head down or head up, they're sideways. It's like a football sitting in your uterus. This is usually a temporary position. Baby is likely trying to turn head down, or maybe they were head down and mom had an impact, like a fall or something, and baby flipped. And they're trying to flip. But transverse is actually a really good place to be because it means it's a lot easier to get them to make that final flip head down. But so then the other three main types of what are breech presentations are babies head up instead of vertex head down. There's three names, and you really don't need to know these unless it's one of your situations, but there's frank breech. This is the most common. It's about 65 to 70% of breech babies will be frank. So frank literally means that they're sitting with their feet up by their head. So their bum is down by the birth canal and their feet and their head are up together. So they're kind of scrunched up, sitting. And so if you were to birth that way, picture the bum coming out first and then the feet and the head come at the same time. I don't have pictures to show you guys, but if you Google frank breech, you'll see examples. Complete breech is when they picture them like sitting crisscross applesauce in your tummy. So their head up and their feet are usually crossed down by their bum. And so they're just basically sitting in there. And then footling breech is when both of their feet are down towards the cervix. So they're really long and extended. It could be one or both feet are extended down towards the cervix. So those are the three main types. Again, frank breech is the most common. And we're going to go more into what those look like in terms of treatment and prevention and birth. So let's talk a little bit now about the history. So really, breech presentations were considered a normal variant of presentations in mothers up until about 40 years ago. And then it slowly started to change. And up through the 90s, a lot of obstetricians were still delivering breech babies. Like no big deal. They were just trained in how to do it and what techniques they needed to do differently. And then in 2003, the Academy of Gynecologists and Obstetricians, the American Council on Obstetricians and Gynecologists, basically declared in 2003 that C-section was the only option. And so most hospitals halted all vaginal births of babies that are breech in 2003. And medical schools have also halted in most places. I think there's a few exceptions in Canada medical schools, but I'm pretty sure all medical schools in the United States, correct me if you know differently, no longer teach techniques on how to birth breech babies. So there's truly a whole generation or multiple generations now of medical doctors who don't know how to handle a breech presentation except through trying to manually turn the baby before birth or just do a C-section. So we're going to go a little bit more into that and what that means, implications for birth later on. But there are still some OBs out there who are trained in it and will perform breech births for mothers. I know one mom who I was taking care of a couple of years ago, and she had a doctor in California. And when she had her breech baby, she didn't try to treat the breech. She just flew down to California and had her baby with that doctor. So if you know a doc who will do it, that's great. Midwives will often do it if they're trained. It's finding the right midwife. If they work in a hospital setting, they likely aren't allowed to unless it's last minute and you don't know that the baby's breech until they're coming out. But there are home birth midwives who will perform breech births at home. Of course, ruling out any risks. And I'm not going to speak for any midwives locally here in Central Oregon, but there may be some here. And wherever you're watching, if you live somewhere else, do your research, interview midwives, interview people and see if they're willing to do it. But before you really settle on having a C-section for a breech baby or a vaginal birth for your breech baby with a special provider, I'm going to go into what you can do if you find out that your baby's breech. What are the options and treatment? What's the prevention that you can do to even prevent it if you're earlier on in your pregnancy? And then what are the options? So I don't see any questions. I know I'm going through a lot of info. I'm going to jump right into treatment and prevention. So prevention is really meaning like, what can you do before the third trimester to prevent baby from becoming breech? And then what can you do if you find out in the third trimester that baby is breech? So I'm going to jump right into what I do, and what I love is chiropractic care. This is something as a prenatal chiropractor, myself, my husband, and our amazing other doc in our practice, Dr. Liz, we're all trained in what's called the Webster technique. Most pregnant women, most OBs, most midwives will know what the Webster technique is. It's very, very well known. It's been around for a long time. And it's a specific chiropractic analysis and adjustment that helps balance the muscles and ligaments and structure of the pelvis, basically creating harmony in the body, in the pelvis, as well as the nervous system, to allow for the uterus to expand and have the most room available for baby to naturally assume the best position for birth, which is vertex head down. And with chiropractic care, we're very serious in our profession about clarifying that it is not a breech turning technique. There are some people who think that Webster technique is synonymous with breech turning technique. It is very, very effective. There are a lot of studies and research on it and ongoing long-term studies on it, and it is highly effective. Some studies say about 80% effective. Some say like over 90% effective, but very effective. And it's very, very gentle, conservative, non-invasive. It's really calming to the body. There's no manipulation of anything with the baby. It's all about balancing the pelvis through gentle techniques, releasing tension in the round ligaments, which suspend and hold up the uterus with gentle, gentle pressure. And then, of course, balancing the rest of the mama's spine and body to make sure that she's aligned and balanced and has harmony in her nervous system and in her structure so that baby can be allowed the chance to move. Because when there's restriction and misalignment and tension in the body, there's torsion in the body, that literally changes the way that the uterus can expand. Think of the uterus as like a hot air balloon. And if there's tension on one side, it's squeezing down because everything's out of balance, then that restricts baby's ability to move. And it leads to what's called in utero constraint. In utero constraint basically means the baby is constrained. They can't move. So they may want to move head down. They may naturally feel that inclination to go in that direction, but they can't. And what's so beautiful about chiropractic care is it's so gentle and it's so effective, and it allows baby. It doesn't force baby. It's not forcing baby to turn. It's just giving baby space. So we don't turn babies in our practice, nor do any chiropractors turn babies. That would be practicing obstetrics. We don't do that. That's out of our scope. But we allow the body to have harmony and balance so that baby can move into the safest position. And again, it's highly effective. And then, of course, it's also very good for you in general. So the most ideal time to start balancing your body, nervous system, and structure through chiropractic care is preconceptively. You can work through old injuries, old postural patterns, old stressors, old tensions, old traumas in your body. Before you even get pregnant, preconceptively, you're setting yourself up for a really healthy pregnancy. Otherwise, first trimester, second trimester, getting your body balanced is key. You can prevent baby from being breech by staying well balanced and well adjusted. We see mamas throughout their whole pregnancy, preconceptively and throughout their whole pregnancy. It's the biggest honor. We love being a part of that journey with moms and then getting to meet baby and see mama postpartum. So we love doing that. And again, all the doctors in our office are trained in the Webster technique. If you're watching from elsewhere, if you want to find a Webster certified chiropractor. So chiropractors who have had extra additional certifications and training in caring for pregnant women. Go to ICPA4, the number 4, ICPA4kids.com. You can type in your zip code and find a provider. If you need any help with that, feel free to shoot a message. Give our office a call and say, hey, I'm looking for a Webster certified chiropractor in this area, and we're more than happy to do some research, make some calls, and find the right fit for you and your family. So again, there's long-term studies, overall wellness, prenatal wellness, preparing your body for birth, and it's so effective and it's so beautiful for overall wellness in pregnancy, but especially for mamas who are breech. So if you've already been getting adjusted throughout your pregnancy, awesome. We definitely see moms who call in the 3rd trimester. We've had moms call at 38 weeks, 39 weeks saying, my baby's breech. And we've seen baby turn through, again, allowing balance in the body and allowing baby that time to turn. But the sooner the better. Waiting until the last minute, it happens. No judgment. We're always here for you no matter where you are. But we definitely, the sooner you get started, the better. And again, that's prevention and treatment, I guess you could call it. I like the word caring for a mom more than treating her. But yes, so chiropractic care is big. If you have any questions on that, feel free to type it in the chat. The other prevention and as well treatment that you can do for breech presentations are exercises at home. So there's a fantastic resource called spinningbabies.com. It's an incredible website. They have videos, YouTube channel where you can do certain exercises at home to create more balance in your body, to prevent breech presentation, as well as there's certain movements like the pelvic tilt technique. I'm not going to describe it to you in here because it'll be way easier for you to just go on spinningbabies.com and look at breech tilt positioning exercises as well as other exercises. There's a whole section on their website for breech presentations and what exercises you can do to prevent and to treat and help baby turn. So spinningbabies.com is something that we recommend all the time for our mamas individually as we get to know their body and what they're needing through their adjustments and their care in our office. If there's a breech presentation, we'll recommend specific exercises for that mom. So working with a provider who's knowledgeable about presentations and biomechanics and harmony in the body as well to know which exercises are best are great. Doulas, if you have a doula, doulas are usually pretty well trained in spinning babies as well as midwives. So those are other good resources to check. Okay, this is more of a treatment versus prevention, but Chinese medicine and acupuncture will use a technique called moxibustion. So moxie is basically like a cone or a stick of dried mugwort leaves. And this sounds a little funny, I guess, but it's really effective. So the Chinese medicine practitioner or acupuncture will basically use this moxibustion. So it's like smoke, basically, to simplify. I think they do it at the pinky toe of the foot and different points, meridians in the body. And it's effective at helping balance the chi in the body, the energy in the body, and has a way of helping babies turn. They don't do it until 37 weeks or later. It can trigger labor, so you definitely want to be full term. And there is a study in actually JAMA, the Journal of American Medicine Association, that moxibustion is 25% more effective than ECV, external cephalic version, which I'm going to go into what that is next. So it's highly effective. I think, if you're a mom who's experiencing breech, it's worth trying all the things. Most moms I know don't want to just settle for the surgical cesarean birth if there are options that they can do before. And hey, sometimes you try everything and there's just reasons why that baby was meant to be born C-section, and that's totally beautiful and okay. We call them belly births. It's totally fine. But most moms who are set on having a vaginal birth, they'll try everything. And I can say that our moms who have been getting adjusted and then they do moxibustion with a Chinese medicine acupuncturist have great results. If you're looking for a referral for somebody who does acupuncture and does this care, I am a huge fan of Kat Starbird of Starbird Women's Health in Bend, Oregon. If you're looking for someone locally in your area, just look up acupuncturist or Chinese medicine person who works with moms and is trained in prenatal care. So now, I mentioned ECV. So Moxie is 25% more effective than ECV in one study, which is really cool. So ECV is basically an outpatient procedure. If you are in your third trimester and your baby's breech and you're working with an obstetrician, an OB, they will likely say that your only option is a C-section, or they can try an ECV. If the ECV doesn't work, then you'll just have your C-section. But if the ECV works, great. So it's an outpatient procedure. It's done either before or during labor. It can trigger labor, so they don't do it before 37 weeks. That's not considered safe. It has to be done before the waters break. So if you have a breech presentation and your water breaks in your full term, they're not going to do an ECV. They're going to put you right into surgery. So it has to be done ahead of time. It's very invasive. They have to give you a medication to relax the uterus to prevent contractions. And then they have to use an ultrasound to look at the placenta and the baby and monitor everything. And then they're literally manually trying to move the baby. So it can be very uncomfortable. I know a few moms who've had it done and have said that it's very painful. They're literally grabbing baby's head and their bum and they're trying to turn baby head down. It's very like a manipulation basically of baby in utero. It's usually about 5 minutes, but it's very uncomfortable. It's 58% effective, according to studies. So it's more than 50%. So for some moms who've tried everything else, and this is the only thing their doctor tells them is available, they'll do it. There are side effects. It can be dangerous for mom and the baby. It can rupture placenta. It can rupture the uterus. It can lead to fetal distress. It can lead to labor sooner than you want it to. There's a whole list of side effects that you could research on ECV, or external cephalic version. And again, it's an outpatient procedure done with your OB. So those are all of the things that are really known. There are some homeopathics as well. I'm not super knowledgeable about homeopathics, but if you wanted to try homeopathics, there's certain ones that a naturopath or homeopathic person can talk to you about. But otherwise, that's pretty much got it covered. Chiropractic care, spinning babies, exercises, moxibustion with Chinese medicine, and then ECV. So what's left is birth. So if you're a mom who has tried everything and you truly don't want to have a C-section, if you can find a provider who's trained and willing to do a breech birth vaginally, then that's amazing. If you're empowered and informed and you know that that's what you want, you can also do it. I do know a mom who did it in a hospital. She had to sign like a crazy amount of paperwork, but she birthed her Frank Breech baby completely naturally, unmedicated, vaginally. She describes it as birthing a loaf of bread, which I thought was amazing, because it all comes out together in that Frank Breech position. But so it can be done. It just takes a lot of knowledge and empowerment and people to support you. And then if you are going to have a vaginal birth, Frank Breech is the safest. So again, that's the one with the feet up by the head, with their bum down by the birth canal. And hopefully things will start changing soon in terms of more providers being trained in breech vaginal births. I know that's happening in California. I'm sorry, in Canada, not California. There was the National Institute of Health Task Force on Cesarean Birth said that C-sections are not needed for every breech presentation, and that there are multiple studies that show that there's no less risk in a C-section surgical birth than a vaginal breech birth for most breech presentations. And that is significant. And of course, if you do decide to have a breech vaginal birth, your provider, whether it's an OB or a midwife, is going to be looking at what the type of presentation it is, the fetal size, their head position, if it's extended or chin tucked, is going to matter. The maturity of the fetus, how labor is progressing. But again, there are options and choices. It depends on where you live. It depends on the providers in your area, whether midwives or OBs, and it depends on you and your baby. But there are options, and I think it's really important that as mothers, especially first-time moms going into this, and it's all totally new, your first birth, just know that there are other things besides just that, oh, you're 37 weeks, ECV, or a C-section. Now, there's other things you can do to prevent and to take care of and help baby turn sooner than just going right in for surgery. But again, if you have to have a C-section birth, that's totally beautiful too. I highly recommend, if you've had any sort of birth trauma, whether through surgical birth or any type of stress on mom or baby, getting you and baby adjusted and taken care of and balanced and cleared of any stress from birth as soon as possible is essential. That's something we're really passionate about and do every single day at Pure Light here in Bend. So really, really important that no matter what type of birth you have, that you also address the tension and stress that it causes on you and baby. And moms who have gone through pregnancies and the stressors, emotional, physical stressors of all of it, make sure you take care of you too postpartum. I have lots of webinars on postpartum care and how you can nourish yourself and take care of you and baby the best you can. So I know there's a lot of information in about 30 minutes. I don't see any questions or comments. Again, please reach out anytime. If you're already a member of our practice as a patient, I'm always here for you to answer questions. If you have friends who are figuring this stuff out, feel free to send them my way. I'm always happy to get on a phone call or an email with them. Again, my email is saralutz@purelightfamily.com. Thank you so much for logging in and listening. I hope everybody has an amazing night and that this was valuable and informative for you. All right, have a great night. Thanks for watching.